So today we're just going to record the position that we want the teeth to be in, ideal position. We're going to record the way that your teeth close together using just a wee bit of wax. We're also going to assess this master impression that we'd taken, so we're going to just assess the fit and where that base sits on there. Okay? We're going to use just a couple of instruments, so this is just a guide so that I'm going to put in so that I know that we've got a nice level plane.
Right.
And also just a wee ruler to check the measurements. Alright. So if at any point anything's jaggy or sore, just let me know, just raise your hand up and I'll stop what I'm doing. Any discomfort as I'm pushing up there? And then just gently close together for me. Perfect. I'm going to ask you just to stay in that position. I'm going to just take a couple of measurements, alright? Just relax your lips for me, but keep your teeth closed. 61. And then if you open up for me, and open, that's perfect. So I'm just going to pop this in position. I've done no bad, I've shaped that in a pretty good position. And then just gently close over again for me. I'm just going to have a wee feel at the joint here, alright? So in that position just now, I'm just going to make a couple of lines and marks on that wax, okay? But so far I'm happy with the position.
Right. Okay.
You'll feel, because you've got big lumps of wax in there.
That's right.
So yeah, if you just stay close together for me. Big smile. And stay close together for me. So I'm just looking at the pupil and a big wide smile. Big widest smile that you can give me. Well done. This is one thing I'm going to do by putting a little bit of material in between your teeth and the block, just to record exactly where you bite together. If you open for me, just I want to have a look once I've got it all mounted on the articulator, the wee machine that mimics your lower jaw movement. Once I've got that done, I want to see the relationship between your bottom teeth and where I want to put the top teeth. And obviously, at the moment, your bottom teeth just bite on all of the teeth, all of your teeth on the denture. But I think you would benefit from a wee bit more support here. So once I've assessed that, it might be that the next time I see you and we've got teeth in trial, it's just a trial, and I might want to change it and go back. But I just think that at this moment, it's good to give that a go, to see what we can improve on and how much we can move things, rather than just sticking to, playing it safe. Are you okay with that?
Yeah, that's fine.
That might be spot on, but it might not be.
Hopefully. I'll keep my fingers crossed.
We had a wee chat about the colour the last time, did we not? And we wanted to keep it to match the bottom ones, but a wee bit brighter. Okay, I'm just going to pop this in and just get you to bite on this, okay?
Okay.
And just stay in that position there for me. So it's looking good that we can give you just a bit more like teeth on show without it being without it being too much, so that's good. And then if you open for me. Perfect. Check if you open really wide for me. And have another wee look just at the edges of the wax, alright? You okay there?
Aye.
Good. Just try and relax your lip. I'm just grabbing you with that hard stuff, I'm sorry. Open. What I'm checking there is where your cheeks come from, sort of top of your mouth round. There's an area where we can fill with the denture that creates a nice tight seal. but your muscles sometimes just want to push that out.
Mhm.
So I'm checking that just now to see if we've got that in a good position. It's a good starting position. Because if we can fill that area completely, it gives us a better seal. So this
Right.
is a bit wider round here
Yeah.
than that, and it just helps create that seal so that when you're functioning, when you're chewing with it, it's less likely to break that seal. So what will happen is when we do the try-in with the teeth in the wax, I'll assess it again, and we probably will find that when I'm pulling on your cheeks, it will move, it'll come down. But I wouldn't make any major adjustments until we fitted the denture and you've had it for a week, because your muscles can adapt and they eventually hold it in rather than push it out. So we don't want it to jump too fast to reduce the size of that, because we do want to give you the best fit over the longest period of time. Alright? You okay? A wee bit.
That's just, I don't know, it's like
Let me have a wee look. I'm just going to shine this light if you want to close your eyes. And I can
see that there? Is there something there? You know.
Here. Can I take that pillow away just so that I can get your head back a wee bit more?
Are you right on that?
Is it sore when I push it? Feels like a bone.
That's what I thought it was.
Is it just that you could feel it pushing on that when I put this plate in? Just close over a wee bit just so I can pull your cheek to the side. Yeah, definitely.
Feels like a wee bit low, eh?
Aye.
That's maybe been there. Oh, different been there.
I know, but just because we put something new in and it's pushing on it, because we've recorded that shape in your mouth. It's quite tight.
I thought it was something sticking.
You're thinking?
I thought it was a wee bit of the blue stuff sticking on my gum, you know.
I'll let you pop that back in.
Right, thank you.
And so it's here. You can see it.
Aye.
That's your.
You can see it.
Aye, so that's
like a wee bit bone or something.
So it's just the shape of your bone.
Aye.
Because there's definitely, it doesn't look irritated or anything.
No.
So we'll just be aware of it, because it may well be that I want to relieve that area a wee bit so there's not as much pressure, because it's quite, there's not a lot of tissue covering it. So it's like your shin. And if you had something pushing on it, it would be irritated and sore.